Good afternoon, everybody. This is Andrea Leonard, President and founder of the Cancer Exercise Training Institute. Many of you are already cancer exercise specialists or going through the Cancer Exercise Specialist course, so I'm thrilled to have you here and taking time out of your busy afternoon. Perhaps you're on the East Coast or maybe even another country. Would love to have everybody introduce yourself and say where you're from. And I'm going to start in just a couple minutes and we'll go through this. I will be answering questions at the end, so feel free to write your questions in and I'll go through them at the end and make sure that they are all answered. We will also have a special offer for you at the end. This breast cancer recovery BOSU specialist advanced qualification is where most of this information is taken from. And for those of you who are not already going through that course or don't already have that advanced qualification, it will be available to you for half price. And I'll give you the information at the end of the presentation. So just hang tight. I'm going to just wait for a couple more people to sign in and we will get going. So for those of you who are just signing in now, this is Andrea Leonard, President and founder of the Cancer Exercise Training Institute and 34-year cancer survivor. I'm thrilled that you can be here with us today to go through this breast cancer recovery with the BOSU Balance Trainer. So let's get started. And remember, I will be taking your questions at the end. So why should you use the BOSU Balance Trainer? Well, this little lovely rainbow of reasons I'm going to go through. It is going to help your clients increase their kinesthetic awareness, proprioception, and postural stability. And as we all know, these can be affected by cancer surgery and cancer treatment. The muscles may be in constant spasm following surgery. There can be scar tissue and adhesions that can affect the posture. Proprioception can be affected particularly by neuropathy, which can be a side effect of chemotherapy or diabetes. And most people don't have very good kinesthetic awareness to begin with. So as a cancer exercise specialist, we have an opportunity to educate our clients on really how to use their own body. You know, they've had it since they were born, but did anybody ever really teach us how to stand up tall? How to stand with good posture. Now, I do remember when I was a kid having my mom tell me to stand against the wall and put a book on my head, and if it didn't fall, then I was standing with good posture. But we have to teach our clients how to engage particular muscle groups. So if you're having them perform, let's say, a seated row, and they don't understand how to retract their shoulder blades, how to engage their abdominal muscles, then more than likely they're putting their low back at risk, but they're also doing more with their arms than they actually are with their back. So I just wanted to kind of expand on that a little bit. They will be able to increase their bone density and, of course, reduce the risk of osteoporosis, which happens to be a long-term side effect of chemotherapy and many of the hormonal therapies because we are depleting the body of estrogen. It will help them to increase their balance and minimize the risk of falling and breaking a bone. So we have people that are older and frail, perhaps to begin with, and then they go through cancer treatment. They may have peripheral neuropathy in their feet. They can have issues neurologically that can affect their balance. So to be able to work in a safe environment, which I'll discuss how we make it safe, and also work on their bone density, it's a no-brainer to me to use this piece of equipment. We can strengthen the ligaments and tendons of the ankle complex, so we reduce the risk of sprains and strains, and that is one of the most common injuries for anybody. So when somebody's weaker to begin with, this becomes even more important. Increase aerobic capacity. The heart and lungs may also be damaged by cancer treatment. Increase the lymphatic drainage. So gently bouncing on the BOSU balance trainer is actually like bouncing on a mini tramp, and there are many studies that show that that can help to improve lymphatic flow, increase the flow of the lymphatic fluid throughout the body, and that's what we want to do when the lymphatic vessels or lymph nodes have been removed or damaged. We run that risk of lymphedema for those particular clients. So this can be part of a lymphatic drainage routine. We're going to help them to increase core strength, and that may also help to minimize low back pain. When you're dealing with a client who, for example, has had an abdominal tram, it is so important that we work on the core. We're not just talking about the rectus abdominis, or getting a six-pack, because for all intents and purposes, that six-pack may now be in the chest area. So it's working all of those other stabilizing muscles. That is so critical. We can correct postural deviations, and that in turn can reduce pain and prevent future joint degeneration. We can help to increase range of motion. So if you think about scar tissue after an incision and surgery, or following radiation, think about how that is going to affect their ability to move their arm and their shoulder joint through the various planes of motion. And then lastly, we can improve functional fitness and the ability to perform activities of daily living. So one of the things that we see most often with cancer patients is depression, and that makes perfect sense. They have low self-esteem, low self-confidence, poor body image, and they can't do the things that they love to do. So if you were not able to do the things that make you, that make you happy, imagine how depressing that would be. If we can help these people perform exercises that mimic their activities of daily living and help enable them to get back to that place, that is just so incredibly empowering. So it's an amazing experience. Now, I am getting a message that you guys are not seeing the slide progression. So can you guys let me know if you see the slides? We should be on the second slide, which has kind of a rainbow on the side. Does everybody see that? Can you send me a message? Okay, great. I am great at cancer, but I'm not awesome at technology, so you'll forgive me if we have some technical difficulties here. So what are your client goals? The first thing when you meet somebody, you're doing that initial assessment, but I think it's critical that we find out, what did they want personally? What are they trying to get out of this experience with you as a trainer? Now, these would be my goals as a trainer, as a cancer exercise specialist for this particular client. So I'm kind of adding that to what they want. Functional fitness is at the top of the list for me, because if they cannot perform their activities of daily living, that really is going to affect their quality of life. Open versus closed chain exercises. So we're looking at stability versus less stability. Working in multiple planes. In order to prevent injuries and to really take somebody who is, I'm going to use air quotes, unfit, and make them, quote unquote, more fit, they must work in multiple planes. And part of that is also going to be balance. So all of these can be accomplished using the BOSU balance trainer. It is just such a great piece of equipment. And I will tell you up front, I am not affiliated with BOSU. I do not get a commission. This is strictly a personal recommendation and a personal favorite of mine. All right, so we're going to jump right into exercise programming now. And as you see in the picture here, it's merely a shift of weight. I'm saying bouncing on the BOSU balance trainer, but and that can certainly be done, but we're not going to start a client by telling them to just bounce on the BOSU. So you see the feet just shifting weight. what you're going to do for starters, we've got this broken into levels. So as we go through these next slides, some of them will have only level 1 and level 2. Some of them will have level 1, level 2, and level 3. I'm going to talk about precautions. We're going to talk about balance challenges, and we'll go through it with each particular slide. So with level 1, you are actually holding their hand, or there to spot them 100%. They are relying on you for their balance and safety. If they can do that with absolutely no problem, and you feel that it's safe for them to progress to the next level, then what you're going to do is you're going to take that BOSU, you're going to put it either next to a wall, or in a perfect world, actually in a corner, so that they have a wall on either side, and then you can be behind them to spot them. And we'll continue. They'll shift their weight. They can maybe add a little more bounce to that. And if they struggle with that, then you are going to regress and go back to level 1. But if they're doing really well with that and they're ready to move on to level 3, that is with no spot and with no props, such as a wall or a counter to hold on to. So obviously this is for the more advanced client, somebody who's got better balance and coordination. Now, keep in mind, if somebody has peripheral neuropathy in their feet, which is burning, tingling, numbness, or pain, that this may not be a good exercise for them, in which case, if they have to warm up on a recumbent bike or something that is safer for them, that is perfectly fine. I love the fact that this is also going to help with lymph drainage, but we're going to get to lymphatic drainage exercises in either case. So keep that in mind, what level they're going to be at, when to progress, and when to regress. We're going to break these down much like we did in your cancer exercise specialist training, how everything's broken down according to postural deviations and range of motion. And I'm not going to go through the entire course because we don't have enough time. So I'm breaking down kind of the main themes here. And we know that with most breast cancer patients, they end up with round shoulder syndrome. Visualize the horizontal incision from the mastectomy, and then imagine radiation damage on top of that, and what that does as the tissue shortens and becomes restrictive, and then add perhaps an incision under their armpit for an axillary node dissection. And then we can add on to that if they have reconstruction. So each time there's another procedure, there's almost like a layer of collagenous tissue that becomes restrictive to that part of the body. So we want to stretch the chest and strengthen the back. Now, mind you, you guys are going to have done a complete postural assessment and goniometric measurements. So some of these may apply to your clients and some may not. Your client, just because they've had breast cancer, may not have round shoulder syndrome. Maybe they just had a lumpectomy and they had great physical therapy afterwards. So you're still going to choose the exercises that are going to apply to your client. So we're going to start off with what we call chest expansion. And many of these exercises you're going to see for level 1 that it's done in the chair. Some people can't even get down to the floor on the BOSU balance trainer, so we're not going to put them in jeopardy by forcing them to do that. You always have to ask yourself, is the risk worth the results? And, the risk may be that they have a hip issue or a knee issue or low back instability, and it's just not worth putting them on the balance trainer. But that client is probably not going to be the person that these exercises are going to truly benefit. So level 1, they're sitting in the chair with their hands behind their head, or like in the second picture, just kind of propped behind them. So that second picture is a modification. Believe it or not, raising your arms and putting them behind your head, like in this first picture, let me grab the spotlight here. So doing this can be really, really difficult for somebody following surgery. And if it's immediately following surgery, there may be pain associated with the movement. But let's say it's 2 years out and they never went to physical therapy, they were never told to move their arms, then they may not physically be able to raise their arms up, in which case we can use this particular exercise as a modification. And notice, yes, these are pictures of me. I wish I had somebody else because I'm not a big fan of my own pictures. But in any case, notice how I'm retracting my head, drawing in my belly button towards my spine. My hands are as neutral as possible to the way they're placed on the side of the BOSU. We want to minimize any flexion or extension at the wrist as much as possible. Okay, so if somebody begins with this first exercise and they have a difficult time with that, we will suggest that they do it in this second fashion. And this is what they'd be doing on the chair. Now, feel free to send me any questions as we're going along, and I'll either answer them right away or get to them later on, but I will answer them. And now I'm having a difficult time. Apparently, you can't have this little drawing tool while you're trying to change the screen. So let's see if we can do this now. Okay, level 3. So we have now established that your client was able to perform at level 2 with no problem. There was no pain. So now we are taking them down on the base of the BOSU balance trainer. So how do we get a client from an upright position on the floor and lying down in a supine position? We're going to start off having them sit upright at the base, and if they have good core strength and they have not had an abdominal tram, then they can actually roll themselves backward. But if they have a tram, if they have low back pain, or you just feel that they are not in good enough shape to actually control their movement back, then have them start on their side and roll over the top of the BOSU balance trainer. So once again here, I'm going to use my little highlighter here. So we start off with the arms straight up, palms are facing each other, the head is in neutral here. So it's really important to look at where you're placing the head on the BOSU balance trainer. And then they are going to open their arms up out to the side, palms up, and they're drawing the belly button into the spine so they are not excessively arching their back. If that is difficult, then the modification is going to be with their arms bent. So of course the other arm is over here somewhere. And then you can educate them and instruct them that they should be squeezing their shoulder blades together. So retracting their shoulders without elevating them. That's what most people want to do. As soon as they retract, they naturally tend to elevate, and that is not what we are looking for. So good form is important, as it is with any exercise. So if you're having your client attempt to do this level 3 exercise and they complain that they have pain in their back or their shoulder hurts or any number of things, then let's have you go back to level 2 until they can do that with no pain. All right, so we have, that's the level 2, and then we did the level 3. Now let's talk about precautions. Now apparently I can't get rid of these little highlights. You can see I am not doing too great with this highlighter, or going backwards for that matter. I apologize. This is a new webinar platform that I am using and am having some challenges here. So I'm not going to try and go back to that screen, but if we talk about precautions, so if they have had lymph nodes removed or irradiated, then you want to be careful of not only range of motion, because we don't want to do too much too fast. You don't want to hold it for too long. You don't want to have them overstretched to where it causes any pain. So think about that when you're doing it, what might be the modifications or precautions. And if they have expanders in, so they currently have expanders in, absolutely no chest exercises. So those last couple exercises, we are going to just do away with completely. All right, now we are moving on. So we've talked about stretching the chest. Now let's talk about strengthening the back. And we are going to begin with a reverse fly. Level 1, just like before, is going to be seated in a chair. If they can do that with no problem, no pain, no discomfort, then we're going to move on to level 2, which you see pictured here. Now I am using a figure 8 band. That is not a requirement. You can use an open-ended band, but what you want to make sure is that they are not wrapping it around their hands to increase the tension, as that can restrict the flow of lymphatic fluid and increase their risk for lymphedema, or increase the lymphedema if they already have it. So we are telling our clients how to position themselves on the center of the dome, engaging the abdominal muscles, retracting the shoulders prior to opening up the arms. And you are looking to make sure that they are not elevating their shoulders. We want to have a slight bend in both of the elbows, of course, and you guys should all know this. And then, of course, drawing the belly button in toward the spine. Now, if your client cannot do this with good form and comfort, then you can go back to doing it on a chair. And if they are ready to have a balance challenge, then we have them stand up on the center of the BOSU balance trainer. Okay, so let's talk about contact points. This is how we make working on the BOSU balance trainer more or less difficult. So take a look at this picture here in a seated position, and let me break out the highlighter again here. Now, how many contact points do we have? We have 1, we have 2, and we have 3. So if I want to remove the challenge, if I want to remove the balance challenge, then I keep all contact points in contact with the floor. For some reason, this is freezing. If you want to make it more challenging, then what we do is we lift off the heel or we lift off the toe. If that is too difficult, then you have them set their foot or their toes back down. Now, for somebody who is incredibly strong in the core, you could even have them raise both feet off the floor, but that's not going to be our average client. Okay, so precautions. I already told you, don't perform while the expanders are in place. There's going to be limited range of motion with implants to start with, because the implants are actually going to move out and in as they move their arms. So you want to make sure that you start with a small range of motion and gradually have them increase, and even start with just a few repetitions to begin with. If they've had a lat flap, there can be instability, and there most likely will be, in the shoulder girdle. So watching that form is going to be really important. Now, why would I choose this exercise with a lat flap? Well, because we are able to isolate the smaller scapular stabilizers rather than with a lat pull down or a row that's more of a compound movement. We want to minimize the involvement of the lat as much as possible, because with the lat flap, remember, that lat is now where their chest muscles are. So as they're doing that exercise, they're going to feel it contracting in their chest. With the tram flap, we're going to educate them on how to engage the other abdominal muscles, and that includes proper posture and positioning, as well as lowering down on the BOSU and getting up from the BOSU. If they've had lymph nodes removed, remember, no wrapping the bands around the affected arm or hand. And if they've had peripheral neuropathy in their hands, then they may also have a challenge holding onto that band. And so we want to make sure that they are not a danger to themselves or to you. So you may want to start with isometrics, and that can be very valuable. Make sure they're not holding their breath, as that will increase their blood pressure. So just keep them talking while they're doing the exercise. All right, moving on to external rotation. So we're still working on stretching the chest and strengthening the back. So in essence, this is the opposite of doing a chest fly. So we start with level 1, seated in a chair. Level 2, as you see here, is going to be kneeling on the BOSU balance trainer. And we are educating the client once again about depressing their shoulders so they're not elevating them up towards their ears. The elbows are locked in. more or less at 90 degrees. Now, if you can, I'd even put a rolled up towel between the back of their arm and their torso, which gives better positioning for their shoulder joint. Notice I'm starting with a very light weight here and drawing the belly button into the spine. So if they have a difficult time balancing on their knees, then we can really do one of two things. One, we can go back to a chair, or even though level 3 is standing, for some people that may actually be easier. So, you know, you can try it both ways. Or for example, if somebody has problems with their knees, then kneeling like this is not going to be the best suggestion for them. So as we progress, whether it be to kneeling or whether it be to standing, if they're really struggling, then we're going to go back to something that's a little bit easier. And I want you to just take a look at this picture right now and think about the contact points. I'm going to review that in a sec. And think to yourself about how you could progress this exercise by making it more of a balanced challenge. What options do we have here? Okay, so here we have an example of kneeling and standing. So let's look at our contact points. Although you can't really see my toes touching the floor back here, in essence, we have 2 contact points back there and then 2 contact points here. Where standing, we only have 2 contact points. So the only way I can increase the balance challenge on the standing exercise would be to remove 1 foot. Or could we perhaps just stand up with the weight on their toes or the weight on their heels? Even though that's not as much of a balance challenge as going to 1 foot, obviously it's much safer. The majority of people cannot stand on 1 foot on a BOSU balance trainer. That is something you can work toward, absolutely. But for now, the balance challenge may be to just simply put the emphasis on the toes or the heel of 1 foot, and then the next step would be to put it on both feet. Now here we have 4 contact points. So I could start by lifting the toes up with 1 foot. And if that were relatively easy, then maybe I lift the toes up on the other foot. And if that becomes difficult, then I put a set of toes down. It's really not an option to remove the knees from this, as that would completely alter the positioning. And I don't know too many people that would be able to maintain good form on that. So hopefully this is making sense to you guys in terms of the progression and the regression. Precautions. Think about the scar tissue. Think about the ability to perform the range of motion. So if they have round shoulder syndrome and they are tight across the chest, think about that external rotation. Is that going to be affected, and how difficult it's going to be for some people? So a lot of people won't even need weights to begin with. We'll start with isometrics and really just focusing on stretching the chest and that isometric contraction in their back to strengthen the back, engaging their abdominal muscles and maintaining good form. As with all exercises, we're going to start and progress slowly because of the risk of lymphedema. And that's only if they've had lymph nodes removed or irradiated. So you want to make sure you're just doing a few repetitions with no weight to begin with. Then you can increase the repetitions and gradually increase weight or resistance if they're using a band. With this particular exercise, I think in the picture I'm shown holding a 3-pound weight, but I would go from 1 pound to 2 pounds to 3 pounds to 5 pounds and so on and so forth. Don't take huge jumps, because we don't know at what point it's going to be too much that may actually cause swelling and lymphedema in that arm. So it's best to take baby steps and go, incrementally with both weight and repetitions. And then consider again that if they have peripheral neuropathy, they will probably have a difficult time, or they may have a difficult time holding the weights or the bands. And it really varies because people are affected very differently. Sometimes people have chronic peripheral neuropathy. Other times it lasts for a short period of time. And the pain level can also vary from moderate to severe. So let's move on to shoulder range of motion and flexibility. So aside from having a mastectomy or reconstruction, let's now think about adding that axillary node or sentinel node biopsy and that incision under the armpit and how that's going to affect range of motion. So we're going to begin with a lat and axilla stretch. So the incision is typically right under the armpit, and think about how that is going to affect the ability to move that arm through that arc of motion. So when we're taking somebody's range of motion measurements, let's say they can only raise their arm to 90 degrees. They're only able to go back and forth right here. Then obviously they are not going to be able to do what I'm doing here in this picture, but we can work toward that. So instead of holding the position, perhaps they go a little further each time. They do it as repetitions rather than holding for 20 to 30 seconds to get the stretch. And the same thing applies with yoga. I tell people if you're doing a yoga pose and they don't have full range of motion, then keep the movement fluid. So for starting off, level 1 would be doing this without the BOSU balance trainer. And although this adds very little instability, it still gives somebody more of a challenge than lying directly on the floor. As far as positioning goes, it's really important that they are able to get down to the floor and over the top of the BOSU with no pain and no discomfort. As far as precautions, a lot of this is going to sound repetitive, but it applies to all of these exercises. Do not perform while they have expanders in place. And then once they remove the expanders and they place the implants, you're going to want to wait 6 weeks before they start doing any real range of motion exercises, or at least make sure that you have the medical clearance from their doctors. There may also be lat flap instability in their shoulder girdle if they've had a lat flap. Otherwise, it does not pertain to that person. If they've had a tram, we're continuing to educate them about their core and how to get up and down from that BOSU balance trainer. And then also think about where there was lymph node removal or radiation, the scar tissue in that area and how that's going to affect their ability to do these exercises. So keep in mind, your exercise program doesn't have to be exclusively on the BOSU balance trainer. You can pick and choose these exercises and maybe incorporate some stretching. Think about doing some active isolated stretching in abduction to complement this particular exercise. It would be amazing. And if you did that first, then they're more than likely going to have better range of motion to perform that particular exercise. Okay, moving on to shoulder abduction standing up. So we're really looking at the same exercise here, but some people may be more relaxed lying down and therefore be able to get a better stretch. So level 1, they'll do this just standing on the floor. And when they are able to progress to level 2, we're going to instruct them to place their foot on the center of the dome of the BOSU balance trainer. And once again, they may only be able to lift their arm up. Maybe they can only go from here to start with. So their arm ends up there. So then maybe the next repetition, they're able to go up a little bit higher. And the next repetition a little bit higher, and so on and so forth, till we have what we're looking at here, which is full range of motion. But think about this, what you learned in taking range of motion measurements, how we talked about people kind of cheating through the range of motion, how they switch planes of motion when we're taking the measurements. Think about the same thing when they're performing an exercise, that getting into and out of that position is really important, because if their arm moves forward a little, now they are in shoulder flexion, and so they're not getting that true abduction. So if we place them with their foot on the BOSU balance trainer and this is too difficult for them, then we simply go back to doing it on the floor until they feel more comfortable and they are ready to progress again. So what are our contact points here? We have the foot here, and we have the foot here. So if we remove the foot from here, I think that's an impossibility, as it would be right here. But we can elevate the toes here. We could simultaneously elevate the toes here. And then if that was too much, maybe we get rid of one of those. Alternatively, we could put the weight on the heel and on the heel here. And if that was too much, we'd back off on one of those. So hopefully this is making sense to you as far as progression and regression. If any of you guys have already been trained by BOSU, this will make a lot more sense to you. It's quite simple, but it's just one more thing to think about. But it allows you to have some creativity in the exercise and keep it from getting stagnant and boring. And you can take the same exercise and really turn it into a variety of different exercises, which is going to keep your clients mentally and physically challenged. So again, we're not going to perform all expanders are in place. We're going to be aware of range of motion with the implants, know that there's instability if they've had a lap flap. Now that we're standing up, we are thinking about drawing in the belly button towards the spine, making sure that there's not an excessive arch in their lower back. And again, just being aware of the limitations because of scar tissue from all surgeries, but also from lymph node removal. Moving into shoulder flexion and also an axilla stretch, except now instead of going into abduction, of course, we are in shoulder flexion. So level 1, we begin just on the floor. And when people can do that with good form and no pain, then we can go ahead and progress them over the BOSU balance trainer and make sure that they maintain a neutral spine while they're doing this. You can see there's a natural curve in the lower back, but we certainly don't want that to be excessive. They're always going to begin with their arms straight up over their chest. So that's the starting position. And what happens very often is when somebody is really tight through here, and we're going to see this both when we're taking the range of motion measurements and when they're actually performing the exercises. So as the arm begins to go back into this arc, sometimes you're going to see the back arch up as well. So they must draw that belly button towards their spine and keep those muscles engaged. And the same thing as with the other exercises, you know, we may start off here and only be able to move to here, and that's their arc. And then maybe the next repetition, they're able to go a little bit further, and so on and so forth, till they have close to full range of motion. And you can see I don't even have 100% range of motion. But if you look right here, and I'm going to erase this in a second so you can see the picture better, you can actually see that my arm is starting to go out a little bit into abduction, and that is where we stop that movement because we don't want them to abduct. We want to keep strict flexion with this exercise. So as I've been stating, if they have moved on to level 2 and they're having difficulty with that, then we're going to go ahead and just get them back on the floor and go back to level 1 until they are comfortable with that before we move on again to level 2. So let's go to the challenge, the balance challenge again here. What are our contact points? So I have 1 foot, 2 feet, my rear end, and my upper back. So I have 4 contact points here. Now, if I remove the back, then I have to have some incredibly strong abdominal muscles. So we're going to just say we're going to leave that alone. If I remove the butt, then essentially I'm going to have to go up into a bridge, which could be done. I would say that would be an extremely advanced exercise. So let's talk about the feet. I'm going to erase these again just so I can start with a clear screen here. So what if I just raised one leg all the way up and I just had 1 foot on the floor? That would be a balance challenge. And that knee can be bent without touching the floor, either way. Or I could lift the toes off of the floor. Now remember, I can do both sets of toes, or I can do just 1 set of toes. So I have many options here. And then I can also lift the heels up. So you can see I've got a number of variations that I can try. And, you know, this might not be all that exciting to your, 27-year-old client who was an avid exerciser prior to their cancer surgery, treatment, diagnosis. But for somebody who was out of shape, deconditioned, sedentary, this is challenging, and it's probably pretty fun. You know, when I've worked with older adults, they love, I'm going to call it a toy, whether it be an exercise ball or the BOSU balance trainer or balance discs. They have fun with that. It makes them feel youthful again. So there's so much more to this than just the physical component. And again, we're going to see the same exact precautions here. So rather than read them over and over, I'm just going to leave it for you. This will be recorded, so you will be able to go back and look at it at your leisure. Now we're moving on to shoulder extension. So I want to give you a visual again here. Think about how tight it is across the chest from surgery, from treatment, from reconstruction, and how this may be bound down here too from the node dissection. So this can be an incredibly difficult movement for many people, although, you know, we take it for granted and it seems like a pretty easy thing to do. Try doing it yourself without elevating your shoulders while you're doing it. So of course, level 1, we're standing on the floor. Level 2, they can actually kneel on the balance trainer like I showed you in a previous picture, but remember that that might not be good for somebody who's got bad knees. And they may actually be less stable on their knees than they are on their feet, although we have more contact points because their knees and their toes are in contact, so they have 4 contact points versus 2. So you're really just going to have to kind of feel it out with your client, but for all intents and purposes, we are going to call this level 3. And we want to make sure that everything is linear from the feet to the thighs to the arms while they're performing their exercises. So let's look at the balance challenge here. Again, we don't have a whole lot to work with here because we have each of the feet. So our options, of course, would be to lift one leg up and stand on one foot, which is very advanced and the majority of people are not going to be able to do. Alternatively, we can lift up the heels or the toes on either or both feet. You might experiment with placing the weight on one set of toes and one heel, or maybe both heels, or maybe both sets of toes. But we don't want to compromise form. We want their belly button drawn into their spine. We want a neutral pelvis. So, I lost it again. I'm terrible with this little mouse here. So you want to make sure everything is in alignment. And I still haven't figured out how to go back with this thing, so I apologize profusely, but I am not apparently that talented. So I'm adding something here. If you look at the precautions, I've added peripheral neuropathy. If they have it in their feet, balance is certainly an issue. And so it's going to be hard enough for them to just stand on the BOSU balance trainer. I probably would not tempt fate by reducing the contact points because they're already going to be struggling if they have bad peripheral neuropathy. So you're going to know your client, you'll know what your limits are and you know what you can push. Let's move on to core strength now. This becomes incredibly important. Obviously, we all need core strength. Prevents injuries, reduces pain, and it's one of the #1 things we need to think about with our clients. But think about having the rectus abdominis actually removed. So it is no longer there to support the tummy area. Now, although it's not the most essential muscle, it is still important. And now we have to educate the obliques, the transverse abdominis, the multifida, you know, all of the spinal stabilizers to now do the work for the rectus abdominis. And one of the primary functions of the rectus abdominis is flexion. So that's why doing something like a crunch is not an exercise that we want to recommend for somebody who has undergone a tram flap. So we're going to start with this great little exercise that is going to work shoulder flexion, it's going to work balance and core. Now you'll notice I have a small weighted ball in my hands. We're going to start the client with no weight, no ball. They can just kind of hold an imaginary ball in their hands, and we'll begin by doing it on the floor. If they can do that with good form, then we can go ahead and progress them onto working on the balance trainer. And we're gonna, this is only kind of showing partial range of motion. It looks like basically like a squat, but then we're gonna have them raise their arms up, and I'll show you in the next slide. The arms will actually go up overhead. So, you know, they're going all the way down to all the way up. So that's going to be level 2 for you, and we can actually add another little challenge here going on to the next one. So here you see we go all the way up, we go to the side, so now we're working the external obliques, we're working those side muscles, and then going up, we want to make sure that they are not arching their back, they're drawing their belly button to their spine. We've got this wonderful flexion going on here at the same time. But what you want to make sure while your clients are doing this is that their thighs are parallel. Their feet are parallel. Now, obviously, you see a little supination because I'm on the dome of the balance trainer, and there's not a whole lot you can do about that. And that's part of how we're strengthening the ligaments and tendons. But I maintain a slight bend in both my elbows in all positions here. And like I said, this could just be an imaginary ball that they're holding in between their hands. And if they experience any low back pain or discomfort, first I would check their form and then, maybe just back off on this exercise and work through smaller ranges of motion and absolutely, without any resistance and not on the BOSU balance trainer, which is going to add another level of difficulty. So don't perform while expanders are in place. And I think, you could just know that for every single exercise. If it involves anything that's going to work the chest, they can't do that while they have expanders. Be careful of range of motion with implants. There can be lat flap, instability in the shoulder girdle. We really need to concentrate on good core form, particularly if they've had a tram flap. They may have limited range of motion, especially in flexion following that lymph node removal. And if they have peripheral neuropathy in their feet, then, maybe standing on a BOSU balance trainer is not the way to go. So, they may even be doing it sitting down, and obviously that's not really going to work their core, but they can still do it to work shoulder flexion. So now we're going to add some gluteal strength. So think about your client who has tight hip flexors. Typically with tight hip flexors, the opposing muscle groups, the glutes, are weak. So as we contract the glute through reciprocal inhibition, the hip flexors have to stretch. So it's a win-win situation. And oftentimes we see this even more exaggerated with somebody who's undergone an abdominal tram. So let's start with a very basic exercise, which is the bridge. And of course, level 1 would be doing this on the floor. For most people, it'll be pretty easy, but they may not even be able to lift up very far off the floor. If somebody's really tight, they may only be able to lift up a couple inches. So we want to work to getting them, kind of in a parallel line there, and then have the knees lined up over the ankles. Feet are parallel and going straight ahead. So when they can do that on the floor, then we're ready to go to the BOSU balance trainer. And while this isn't a real balance challenge to begin with, what can we do here? What are our contact points? We have 2 hands, so we got 1, we got 2. In essence, we could even argue that we have the elbows, we have the upper back, and then we have both feet. So 1, we could remove 1 leg and just have 1 leg straight out. We could go to the toes or the heels or any combination. We could lift a hand off the floor or lift 1 arm off. And the thing that I want to warn you about that, however, is particularly, with breast cancer, which is what we're talking about, that's going to put more pressure on the other arm. So, for example, if the right arm were the affected arm and you lifted the left arm up, then you're going to have even more pressure on the right arm. So that strategically isn't the best choice to make. And then, of course, we can't lift off of here because I think we'd have some miracle. It would be like walking on water. So I think the safest thing is going to be to either lift 1 leg or the other leg up and then to alternate heels or toes to make that more challenging. And remember, you can regress and progress at any time, and that people are going to have their good days and they're going to have their bad days, and you will work accordingly. This is a level 3 bridge. So you can see actually here I'm doing the bridge with 1 leg up. We've changed the position. So you can also do just a level 2 bridge like this too, with their feet on the ball instead of their torso on the ball. But we have similar contact points. They're just in different positions. This is going to put all the effort into 1 leg, and we're going to emphasize contracting the glute, flexing the foot. It's difficult to get the knee right over the ankle in this particular one because of the positioning next to the BOSU. If this is too difficult, which it will be for most people, at least starting off, then we go back to level 2 and go from there. So looking at our contact points, let's get this here again. I'm going to go to this one since we kind of discussed the bridge. We've got this, and we've got this and the hands. So really our only option, I guess I should count this too, is even with one leg up, I can lift my toes up here, or I can lift my heel up to make this even more challenging. So with a flat foot, it's going to be more stable. Go to the toes or go to the heels. That takes away some of the stability. And then if they have a hard time with the leg up in the air, we simply go back to both feet on the BOSU balance trainer. With the precautions, notice we don't have as many here because we're not talking about shoulder range of motion, which affects a lot of things. So core education with the tram, and that means educating them on how to get on and off of that balance trainer. They're going to have to go sideways. They will not be able to roll back, particularly if they had a bilateral tram. With one side, they can possibly do that, but I wouldn't recommend it because then we strengthen the one half of the rectus while the other half of the rectus is in the chest area, also becoming stronger because the brain doesn't know any different, and we create more of an imbalance both in the chest and the abdominal area. If they've had a gluteal artery perforator and they've had that surgery, we want to make sure they are at least 6 weeks out of surgery before doing anything that is going to involve the gluteal area, and make sure that you have your medical clearance. Superwoman, great exercise. Bird dog, another name for it on the floor, but we are naming it Superwoman because women who are going through this deserve to have that title. So level 1 is on the floor. Level 2 is positioned on the BOSU balance trainer. And I want you to take a look at the alignment, the knee under the hip, and then the wrist under the shoulder. Now, once again, you want to think about how long you are having them hold this on any given side, because if they're positioned on the affected side, okay, all of that weight and stability is put on that arm, and that is going to increase the risk of lymphedema. So I would only hold it for like 1 Mississippi, and we want to get as complete a range of motion in the arm as possible, extension of the leg, and then we are contracting the glute. So these are the cues you want to give your clients while they're doing this. And then, of course, drawing the belly button towards the spine. So they should have a really nice neutral back. And in this picture, I would actually like to see my head a little more in neutral, but in hindsight, I was probably looking up a little bit. So you want to try and get your clients to relax their head, and I tell them to think about flying through the sky, and they're looking down at earth. So balance challenge, how can we make this more challenging? We have 1 contact point, 2 contact points, and 3 contact points. Now, we can't lift the knee off or we would be floating, and highly unlikely that you would have both arms out here unless you were a stuntman or somebody who's super strong and great coordination. So that is going to leave us with simply lifting. Whoops, we're either gonna, I did it again, my Lord. Next time I do a webinar, I definitely have to figure out how to go backwards. So for starters, you can lift the entire foot and then everything is on the knee. Or if that's too much, then you can just lift the toes off, but kind of keep the foot against the edge of the BOSU balance trainer. So in this particular case, as far as precautions, because we are involving the arm again, there may be some shoulder instability following a lap flap. If they have a risk of lymphedema, remember, holding that position on that arm for a long period of time can increase their risk of lymphedema. If they have peripheral neuropathy in the hands, it can be painful also to, be positioning themselves with their weight supported on their hand. Educate them on drawing their belly button to the spine, keeping a neutral pelvis, and keeping all those muscles engaged following a tram flap, which we're going to tell people that anyway. And then if they've had a gap flap, make sure that they're at least 6 weeks out and that you have their medical clearance form. Working on oblique. So as I mentioned, with the abdominal tram, we do not want to be doing crunches, even if they can do them with the remaining rectus abdominis. It's just not a sensible exercise because we're creating more of an imbalance. So we can start this exercise sitting on the chair. Again, I'm holding a very light weighted ball, probably only 2 pounds at that. So start with no weight and then gradually increase the weight like you would with anything else. So when they can do it in the chair, we're instructing them to draw their belly button into the spine. You know, my eyes are following the ball, but sometimes I'll just have somebody look straight ahead, which helps them with their balance. Sometimes the movement of the eyes will throw them off. And then if they can move on to the BOSU balance trainer, that is going to be level 2. Make sure their feet are in alignment, their thighs are in alignment. You know, everything's linear. And then if they have a difficult time with this one, we go back to doing it on the chair. So what are our contact points here? We have the rear end here, and then we have each foot. So we could conceivably lift one leg up, straight out. That might be too much of a challenge for somebody. So then what if we alternate between, you know, going up on the toes or the heels? We can do one foot or both. And then to be honest, somebody who's incredibly strong, so, you know, maybe they were super athletic to begin with, or this is a year into training, you know, maybe they can raise both legs out. But that is very much down the line, and certainly a very, very big challenge for the majority of people. There are no contraindications with that to speak of, you know, other than something else that the doctor has told you about. So I am going to move on to winged scapula as we come close to the end of this presentation here. And we start off with just doing this on the floor. And if they can do that with no problem, then we will move on to positioning over the dome of the balance trainer. And we start with the arms straight up, just like we did in a chest fly. Palms face each other, and it's very difficult to see the movement here. So I showed you, I put an arrow in here so you can see, but what's actually happening is this is lifting up off the BOSU balance trainer, and it's only lifting up maybe 1 or 2 inches for most people. So following a lymph node dissection, sometimes there is damage to the long thoracic nerve, which can cause a temporary ceasefire to the serratus muscle, and this will help to strengthen the serratus. So when you see somebody with winged scapula, even if they have not had breast cancer, oftentimes that's the issue. So this is a great exercise that you can recommend to them, and that will help to strengthen the serratus muscles. There is not really a balance challenge there. It's just not meant to be a balance exercise. So we've got a little instability with the BOSU, but other than that, focus on core education for the tram. And just in general, we always want to educate our clients to keep a neutral spine, draw the belly button towards the spine, make sure they're not excessively arching the back. And positioning on the balance trainer is going to be critical so that we make sure that their head is comfortably placed. So lymphatic drainage, any of your clients who are at risk for lymphedema, they've had lymph nodes removed or irradiated, you can substitute these exercises for the routine that you have in your book, or you can couple it together. We start off again with bouncing on the BOSU, and just like the first slide we did, they start with assistance, then you put it in the corner, and they have the walls, and then moving on to no spot and no props. Then we move on to forward neck flexion. Tell them to not put, they're not pushing on their head. It's just they're tucking their chin to the chest, and then the gentle weight of their hands are on the back of their head. We're not doing contact points here because remember that our point with this is not so much balance or coordination. We're giving them a little instability doing this on the BOSU, but we don't need any more of a challenge for this part. So level 1 is on a chair, level 2 is on the BOSU balance trainer. If somebody has had neck surgery, then it's not that they can't do it, but I would not place the hands. I would just have them tuck their chin down. If they've had a cervical fusion, check with their doctor before they do any of these neck exercises. And if they have osteoporosis in the cervical area, I would not do this exercise at all. Lateral neck flexion, again, level 1's in the chair, level 2 is on the BOSU balance trainer. If they do not have the ability to do internal rotation, then this will be very difficult. But most people, the one thing that will not be limited is internal rotation, unless they've had a lat flap. So most people can do this, but they could also simply have their arm just straight down right here, even holding on here with their fingers, pulling up on that to create a counter stretch by depressing the shoulder, and then they are tilting their head over to the side. Just the weight of their hand is on their head, and their head should be a neutral, essentially looking straight forward. Same thing as far as neck surgery and osteoporosis. Those are your contraindications. Make sure you get medical clearance. And with the osteoporosis, I would not do that exercise at all. Next is shoulder shrugs. We are on the floor for level 1 and standing on the BOSU balance trainer for level 2. I'm not saying you can't make a balance challenge by moving around the feet and the toes and the heels, but I would focus more on just them performing the exercise with good form to start with. So we're telling them to elevate the shoulders up to the ears and then actively depress the shoulders. So with all of these, with the stretches, I would hold them, if possible, 15 to 20 seconds or longer. But with the ones that we do repetitions, I would repeat 8 to 10 times or whatever number is logical for you with your particular client. And prior to doing any of these lymphatic drainage exercises, that bouncing on the BOSU or whatever warm-up they can do is really important for, optimally for 5 minutes prior to. So think about the balance challenge again. Think about the contact points, ways you can make this more challenging with that individual, and also think about peripheral neuropathy, because if they do have it in their feet, then standing on their feet for a prolonged period of time alone can be painful, and being on the BOSU can not only be painful, it could be a little bit dangerous, is a bit of a stretch, but it could put them at risk for injury, because sometimes they can't even feel their feet. There's very little sensation, so therefore it's very difficult for them to gauge the contact with the BOSU balance trainer. So if you have to stick with level 1, that is fine. Then we move on to shoulder rotations, and I'm actually, although there's no way to show the motion here, I'm doing circles, at my shoulder joint while I'm doing this, and I'll go 8 to 10 times in each direction, depending on the client. And bear in mind that some people who can't even raise their arms up to 90 degrees are not going to be able to do this, and that's okay if you have to skip that. So again, I'm putting this here for you to think about. What are the contact points? How can you challenge this? And with most of these that they're standing on the BOSU, it's really either going to one foot or to alternating heels and toes. And I'm going to just repeat the peripheral neuropathy. If they can't feel their feet or it's painful, then let's have them stick with the floor, and in some cases even sitting in a chair. And then shoulder blade squeeze. We are squeezing the shoulder blades together isometrically. Remember, that will raise their blood pressure if they hold their breath. Make sure that the shoulders are staying down, that they are not elevated, and they are squeezing back as if they have a tennis ball between their shoulder blades. Pelvis is in neutral, so if you were looking from the side, you would not see an excessive curve in my lower back, and the knees are slightly bent. While they are performing this exercise, everything is in alignment. And we've got the same contact points, so it's going to be the same balance challenge throughout if and when you're ready to add that in, and the same thing with peripheral neuropathy. Then we go to chest squeeze, which is also isometric, and so make sure they're not holding their breath. Talk to them while they're doing it. The shoulders stay down, so they are not elevating them, and they are squeezing their hands together. Slight bend in the knees, neutral pelvis, belly button toward the spine, feet, everything are in alignment. Okay, and same thing, balance challenge. This is where it gets you guys thinking. Peripheral neuropathy, and then lastly, we finish off with the fist clench, so we don't have to worry about peripheral neuropathy because they're sitting here. And again, this could be done in the chair, and it can also be done standing up, so you can decide, maybe they're just tired by the end. And they are going to elevate their arms up, and they are opening and closing their fists, squeezing it together, thinking of basically pushing that lymphatic fluid out of their arms into the torso, which we've just made space for through these other exercises. And now they are ready to begin the exercise program. So now you can, basically you would have done this lymph drainage program before any of the other exercises, and then you would pick and choose. And we have a lot more in the BOSU course. Don't have enough time to go through that today as we are out of time, but I am going to stick around and answer any questions that you may have. Here is and actually this didn't work out real well because somehow it didn't copy. I don't know if that link will work, but if you go to thecancerspecialist.com and click on the shop page, which is one of the first tabs, go straight down to the Breast Cancer Recovery BOSU Balance Trainer course, and it is half price through August 6th. So it is normally $300. You are going to get the handbook download. You're going to have access to the video and the 100-question exam, and you will be able to add that to your resume as a breast cancer recovery BOSU specialist. And we have CEUs through NASM, through ACE, a number of different organizations, which slipped my mind, I'm sorry right now, but they are listed on the website. So thank you so much for taking your time to be with us today. And for those of you who are listening to the recording later, I hope that you gained some great knowledge from this. And again, apologize for my technical difficulties. This is a new platform. So hopefully next time I will be more of an expert. And have a fantastic day and a great start to your week. Thank you. Okay, there's a question here from Shannon. How long do you have to do each level? Really, that's kind of an open-ended question, a great question, but it depends on the client. So if they perform well and there is no pain and they have, they're good with range of motion, because if I would want to work on range of motion, let's say in a seated position before I would put them on the BOSU. Work on the simple things that are more critical in terms of performance, and then move on to the next level. So it's really going to depend on your individual client. They may never be able to move on to the next level, but if you see them with good form, all of the points that I made are addressed, and you feel that they can try the next level, give it a try. And if they show panic on their face or express that there's some discomfort or pain, then just simply go back to the first level and say, you know what, it's okay. It's okay. We'll come back to this. Don't be discouraged. It's all part of the journey. So hopefully that answers your question, Shannon. If anybody else has any questions, I'm going to hang around for another minute, and then I am going to sign off. So I will wait for a minute and see if anybody poses any more questions. Okay, how many CEUs are offered? Well, I know right off the bat that it is 1.9 NASM and it is 2.2 ACE, and the other organizations, it's usually around the same. Like I said, for some reason I have those two in my mind. And then there's another question: how many questions are on the test, and do I have to do it all in one sitting? And there are 100 questions on the exam, and you do have to do it all in one sitting. However, it is not timed, so at least that takes some stress off of you. You can get up and go to the restroom or grab something to eat. You just don't want to sign out of the computer. So on that note, I don't see any more questions. Have a wonderful day, and thank you again for being here. Bye-bye.